Hi. Heart disease is one of the leading causes of death in Americans. Hi, I'm Sue de Blasio, and welcome to Through Sue's Eyes. I thought I'd talk a little bit about my heart disease and the test I had to go through eventually. Not testing for every heart disease, but this is what I had. When I was I'd say in my mid-20s, and even earlier, I think, but I wasn't realized at the time, I did have supraventricular tachycardia, which is an abnormal rhythm, but it is a fast rhythm that starts, fast but regular rhythm, that starts in one chamber of your heart, and then the rest chimes in. So I would say in my mid-20s, I had a severe attack where my heart rate was 130 and it wouldn't stop. It just stayed at 130, and it was really, really scary. And I thought, I'm having a heart attack, what's happening? I went to the doctor. They ran EKG tests and echocardiograms, etc. And eventually put me on medication, which brought my heart rate back to normal. I shouldn't say rarely, off and on, I would have speeding heart or palpitations, depending sometimes on medications I took, such as antibiotics, etc., or if I was upset. Usually emotional stress will cause that to kick in also. But for the most part, it was pretty good. And I was on the medication, and, my cholesterol was great. I wouldn't say great, it was really good. And my blood pressure, it's always been low. So there was not really a reason to think that there would be a problem. And my doctor, my primary care doctor, kept prescribing the medication for me. And I went along my way until, a few years ago, I thought, well, maybe I should see a cardiologist again. I had once, and I kind of had a bad experience. That was when I was in my 20s. And when they first found my tachycardia. And he had said to me, and this was, I don't know, it was crazy. He said to me, now if you just go home and lie down on the couch and relax, this may resolve itself. And I said to him, if I could lie down on the couch and relax, I wouldn't be here. So, hence, that didn't work out. And I kind of got a bad taste in my mouth from that. Like, oh, you're just anxious or whatever, blaming it on something else instead of what it was. And sometimes that happens. So I went to a new cardiologist, and this is a test that I think should be mandatory and covered by insurance, to be honest with you. And it's a calcium scan test. You have to pay for it. It's not covered by insurance at this point. I think I paid $50. My husband paid $100, depending on who you go to. I know it sounds like a lot, but they had my cardiologist just on a whim said, "Oh, why don't you have it? You'll be fine." Well, I wasn't. I have good cholesterol, like I said, low blood pressure, but I came back with clogged arteries. So we went from there to a nuclear stress test. And my cardiologist was really concerned because my score was 300. And I guess that is an indicator that in not too distant future you could have a heart attack. But so he sent me for the nuclear test. They do shoot you with a radioactive tracer, and it's kind of like a whole day event. radioactive tracer, and you sit for like 30 minutes to 45 minutes, and then they go and take pictures of your heart. This goes on a few times, and then they take you in for the stress test. I was not on the treadmill for the stress test. They inject you with a medicine that opens up your arteries and simulates in your body like you're exercising. So it speeds up your body in effect to make it think it's exercising. And it will make you feel like you're losing your breath and also, nauseous, etc. And some people have no reaction to it. I did, but it wasn't, they have a medicine they can inject you and it reverses those symptoms. So I took that, and I think my cardiologist expected to shoot me into the hospital and do surgery on me, but come to find out, my blood flow was okay. It was not super spectacular. I do have calcium in my arteries, and I do have that disease, CAD, but coronary artery disease. And what I did end up switching cardiologists, to be honest with you, because the one I was seeing wanted to put me on really high doses of statin, and the medication I didn't get along. And considering my cholesterol was low and my blood pressure, my new cardiologist felt that wasn't necessary. So I have been trying through exercise. I will try and start new medication, exercise, try to eat healthy, etc. And I had my cholesterol taken just a month ago, and it was pretty good. So I'm not suggesting that everybody will be that way, or that's the road they should take. Again, as I always say, I'm not a physician, and there are days I wish I was, but I'm not. So that's some of the testing you may go through if they find or they suspect that your arteries are clogged. But I can't stress enough how I feel that calcium scan should be mandatory, because like myself, it looked, from all outside experiences, my EKGs are fine, my echocardiogram is fine. All outside appearances or even tests showed I would be normal. Even my cardiologist was shocked that it came back that way. So that's just a thought that I wanted to put in your mind. If you're nervous about, heart disease, etc., maybe you should ask your cardiologist about the calcium scan. Outside of that, I hope you had a nice holiday, and I hope things go well, and I'll see you next time.